Well, good afternoon, everybody. We're filming out of beautiful Helena, Montana today. It's been quite a while since we've done any updates, but today we're bringing you the Blue Collar News, and we have AFGE 4012 local president Jordan Harwell, based out of Butte, Montana, and he'll be doing the show with us today, and hopefully we'll get some questions answered and. Everybody will have a little more information by the time we're done. Go ahead, Jordan.
Yes, thank you, Jason, for the invitation to participate in this podcast today. My name is Jordan Harwell, and I'm local president of American Federation of Government Employees, AFGE Local 4012, and I'm based here in Butte, Montana. And our local represents Social Security employees in Colorado, Wyoming, Utah, North Dakota, South Dakota, and right here in Montana. In Montana, there are, a lot of different Social Security field offices: Kalispell, Missoula, Helena, Great Falls, Butte, Bozeman, Billings, Havre, and Glasgow. And our hardworking members, employees, help serve the American people at those offices. Now, currently, there's over, more than 264,000 Montanans who receive Social Security benefits, injecting millions of dollars into local economies. I want to be clear, our members help to ensure that beneficiaries are paid on time, that their questions are getting answered, and that people get the service that they need. So our members do a great job serving the American people and doing their best, and are truly members of their communities. In many cases are going above and beyond to help some of the most vulnerable people that live in their communities.
Right on. So could you highlight some of the work you guys do in different communities?
Sure. Yes. A big factor, a big responsibility that we have is, processing applications for retirement benefits, for example. Our members also process applications for Social Security disability insurance benefits, supplemental security income benefits, which is a needs-based program based on income and resources. And our members also help the public via front-end window interviewing. So if you visit an office, you may be interviewed and have your questions answered. But also, we have members that ensure that applications are quality. They work in quality review, ensuring that disability applications are accurate. And we also answer telephone calls from the public and answer general inquiry questions. Basically, being available in a multitude of different ways to help the public get their questions answered.
Oh, wonderful, wonderful. So tell me, how's the shutdown, the federal government shutdown, impacted your membership?
Well, it's been very difficult for many of our members, particularly the financial impacts that the shutdown has had. Now, most of our membership have been accepted from the shutdown, aka meaning that they're working full-time without pay. Now, that situation has caused a significant hardship for many. You're talking about, this coming Friday is going to be the second full paycheck that our members have missed during this time. So in the last paycheck that was received was partial. It was light. It was missing, 3 full days. So now you're running into a situation where many of our members are working full time, going to work every day, but aren't getting a paycheck. Obviously, this is having a very difficult, this is very challenging for many, myself included. I'd be remiss to say I've had to call my mortgage lender to try to get an extension on paying that. But an entire month at this point without a paycheck, while you're still going to work all full time for many, it's been extremely challenging. And I think it's fundamentally unfair, because here's the thing, is our members are working hard to get people their earned benefits while their own financial situations suffer. I don't think it's fair that our members have to go to food banks and wait in line in food banks to feed their children when they're working full time. They should be getting a paycheck for their work, and this disruption in pay has caused significant challenges for many, and is exacerbating, a lot of the problems that we've been running into over the last few years regarding staffing. For example, Social Security in general is understaffed. I mean, we're at historically low staffing levels. And within Montana, I mean, we have field offices in Montana that are way understaffed than where they should be. For years we've warned that that the agency is understaffed. And I fear that this kind of this shutdown and this disruption in pay is going to push even more people away. It's been extremely challenging for many.
Right. No, that's terrible. I hadn't thought about the fact that people are getting foreclosed on and everything else just due to the inability to pay because they aren't getting their normal paychecks. And I'm glad the bank's working with you on that for certain.
Well, and a lot of people a lot of folks have had to reach out to their mortgage lenders or to their landlords or to other creditors, student loans. I mean, all these different expenses that people have on a monthly basis. I mean, yeah, it's like like a credit card bill. I guess you could say, like, you can defer like paying off that credit card bill, but best believe the interest and fees are going to be piling up and tacking on. So, I mean, just because they agree not to, like garnish or take those kind of actions, doesn't mean that there's money that's being spent, and expenses are rising because these interest and fees are still piling up. I don't know if my lender is going to charge me a fee for paying late. They might forgive it, but a lot of then they don't have to. There's nothing that says they have to do these things. So it's a that part's definitely a challenge too, because even when appropriations are passed and employees are provided that back pay, I mean, a lot of them are going to experience having to pay more for something that if they were able to pay on time, there wouldn't have been these fees and interest tacked on, right?
Right. It's just the unforeseen penalties that you're accruing. So
exactly.
Yeah, it's definitely a terrible deal. So what steps have you guys taken, has AFGE taken to contend with the shutdown and mobilize your membership?
Well, we've been really prioritizing and focusing on getting resources sent over to our members. For our part, I mean, we've been sending constant email updates to our membership. I've spent a lot of time trying to compile different resources like financial assistance, energy assistance, resources on childcare, healthcare, and all, any kind of financial or, shutdown related assistance that we can find. And within AFGE, I mean, our council, within AFGE, I mean, we've compiled a spreadsheet. This is a living document with different resources on it. So trying to get our members as much information as possible on available resources, which have been growing, over the span of the last month plus, trying to get them information on that. But beyond sending resources and information on that, we've also been advocating, for more flexible work arrangements during the duration of the shutdown, particularly with episodic telework, for example. We've got, I mean, in Montana, we've done studies. I mean, and on average, the average employee in Montana could be spending as much as, $100 or plus commuting to work each week, without knowing when they will receive a paycheck, right? And these commuting expenses, I mean, this is one of these expenses that can't wait. I mean, getting to work costs money, right? And we've been advocating for more flexible arrangements with telework because of the financial hardship. The vast majority of work, that we perform is portable, meaning that it can be completed while teleworking. Now, telework is one of the best retention and recruiting tools available. Telework is a huge priority for employees. It's a tremendous benefit that increases productivity and efficiency. Now we've seen attacks against telework, but we've been pushing for that flexibility, regarding telework, because people are really having a difficult time even putting gas into their cars to get to work. And if they can perform the full function of their position while teleworking, I mean, it's a no-brainer that this is the kind of thing and flexibility that should be approved. The American people get taken care of. The employee doesn't, the hardship that the employee's under isn't being exacerbated, and everybody wins with it. So these are the kind of flexibilities that we've been pushing for. That there should be flexibility with this, and there should be cognizant, of the financial hardships being faced by our members. I mean, a lot of employees live paycheck to paycheck. This disruption, now a month-long disruption of their pay, I mean, it's upending, a lot of employees' ability to even put gas in their car. And so that's what we've been pushing for, and we're going to continue to push for it. That's the kind of flexibility that can really help employees. It should be embraced.
Right. Anything helps in a situation like that, for sure. So, what else are you calling for members to better serve Montana?
Well, to better serve Montana, I mean, we've been calling for them to, to keep doing their job. They've been serving Montana since the beginning of this, and long before. We've been, we've faced unprecedented staffing losses. I mean, attrition is very high. I mean, employee retention is very low right now. Attrition's high. But our members are showing up. I mean, I want to be clear. The only reason Social Security checks are going out, that questions from the public are being answered, and, applications for replacement Social Security cards, all these different things is because of the hard work of our members. So to be clear, I mean, our membership in Montana is serving Montanans and doing their absolute best, despite, the difficulties associated with the shutdown, and this ongoing disruption to pay. So they've been serving Montana, from the jump, and they're continuing to do so. Despite, the many challenges that are currently being faced.
Right on. So I guess I need to ask, what are the available resources that you have for your membership, and how can they utilize those?
Sure. Well, again, I mean, we have compiled lists and links and information on, different shutdown resources. I mean, for example, compiling a list of different financial institutions, for example, that are offering, for example, short-term loans, mortgage assistance, deferments to, different creditors. So we've been really trying to get the messaging and get wording out there and information to people so that they can take a look at their options. Morale is extremely low right now for many, but we've really been trying to do our best to, get folks resources and know that there's hope, that we're going to get through this together and united. And I really do believe that. And, I think it's been working. I mean, I know the difficulties that many are facing are severe right now, but we're just trying to do our best to be there together, and then we're all in this together, and we're going to get out of this together.
There you go. Sometimes it's a group effort that gets you to where you're going, for sure.
For sure, yes.
So, do you have any additional information or anything else you'd like to talk about today while we're here? Just in case we missed something that might be pretty pertinent.
Yeah, I mean, I just want to be clear. I mean, we're, our members in Montana, I mean, we're on the front lines, serving Montanans, doing the best they can. And I think sometimes it doesn't get recognized enough. The hard work of our dedicated public servants. I mean, it's something that should be admired and appreciated. I mean, there's a lot of, like I've mentioned earlier, I mean, there's over 264,000 Montanans are on Social Security benefits in one form or another, right? I mean, you're talking about thousands of people a month that are visiting their local field office or calling. Our employees are really doing a lot, to help, Montanans. And I want to be clear, our members, they're members of their communities. We've got people that are Little League coaches, who participate in volunteer activities, who are involved in civic engagements. I mean, we've got people that are really true bona fide members of their communities. They work hard every day. A lot of the, individuals that are being assisted, they're some of the most vulnerable people in their communities, right? And our members are going above and beyond helping those people, and I admire them for it. I think that their courage and their resolve, I mean, is something that should be admired. Like I said, I mean, this has been extremely difficult for many, this disruption to pay. But I don't want to lose sight of the fact, I mean, the important work that our members do, should be appreciated and recognized. And I hope to do that today. And I appreciate you very much, the invitation. But our members are serving, they're on the front line. They're continuing to serve today. Thank you so much.
Right on. Well, thanks a whole bunch, Jordan. And I guess that concludes our segment for today. And just so you know, we're hoping for the best, and the AFL-CIO here in Montana is willing to help in any manner we can to further your position, and hopefully this works out okay for everybody in the end. So,
hey, thank you very much.
All right. Good morning, everybody. This is Jason Small, the Executive Secretary of the Montana AFL-CIO, and we are shooting another segment of the Blue Collar News today. So for today's segment, we're joined by the Chief Executive Officer for the Montana Nurses Association. So thanks for joining us today, Vicky. And to start, I'd like to ask you who the Montana Nurses Association represents.
Yeah. Thanks, Jason, and thanks for the opportunity to speak, for sure. The Montana Nurses Association is a professional nurse organization that represents registered nurses across the state, whether they're an RN or an APRN. And under that professional association umbrella, we have a very strong and productive collective bargaining arm. So we represent nurses in all practice settings: hospitals, clinics, public health, education, you name it. Nurse leaders, we're there for them.
Excellent. How spread out is your crew? Where all do you have people at?
We are all the way from Sydney to Kalispell, from Dillon to Havre. So we are across the entire state. We just had our annual convention last week, and 2 people drove over 12 hours to be at convention. So Montana's big. It takes a while to get there. So we're super proud of our nurses being a part of that.
Oh, that's spectacular. Mm-hmm. So recently, MNA has been highlighting the importance of renewing the Affordable Care Act tax credits, sorry. Yeah. And we're already starting to see premiums go up. What are your concerns, and how will this impact healthcare in Montana if they're not renewed soon?
I'm a lifelong Montanan and a lifelong nurse. It's what I've done, and it's all been here in Montana. And I do really see firsthand how vital affordable healthcare is, not just for the patients, but the entire system. And right now we're fighting to protect those ACA premium tax credits along with Medicaid, but this serves as a lifeline for many of our rural communities, especially farmers, ranchers, small business owners, and their families. And these subsidies don't just help people afford coverage, they keep our hospitals open, especially in our rural communities. When a farmer has insurance and he comes in for care, or she comes in for care, that visit brings in critical revenue that allows those rural hospitals to stay afloat, pay the nurses, pay the providers, and the staff who care for our communities every day.
Right on. Extremely important. So how many Montanans will be affected by premium increases, and how much should we expect for those to go up?
Yeah, the most recent, data that we have on that is if Congress doesn't act, the consequences are going to be pretty devastating. Over about 57,000 Montanans rely on these credits. That's a lot. We only have a little over 1 million people in the state, right? So without them, premiums could rise by anywhere from $650 to $870 a year. That's a lot of money for us. That's a lot of money for me and you. And thousands could lose their coverage entirely, which would be very devastating. And nearly 70% of our hospitals are rural, among the highest in the nation. And these facilities are critical for their access to care. So without that coverage, Montanans delay care, they delay essential care, they skip preventative care. And then when they do arrive, they are sicker and harder to treat.
Right. So other than, as you've mentioned, like facility closures or whatnot, how would this affect people who don't get their health care through the ACA?
Yeah. The people that don't get their health care through the ACA, they're going to see their premiums rise as well, because they then will compensate for those that are uninsured or underinsured. So it's this terribly complicated balance. And we have to level that playing field, and we have to invest in our communities to make sure everybody gets the health care coverage that they deserve.
Right. So you were mentioning about the density of people in Montana, and I know that we're actually considered a frontier state for a lot of intents and purposes by the federal government. So that puts us in a pretty interesting situation. So can you explain maybe some of the other issues facing rural healthcare providers, especially in the small towns and extremely rural communities?
Right. I think one of the biggest things, especially our rural or frontier areas where we have facilities or clinics that our communities can access, is if we don't invest in those workers or invest in the nurses and the providers there, how are we going to retain providers? How are we going to recruit providers? We have to invest in that. We have to have the compensated care so that they have the monies to invest in those communities. We know that our communities exist because of the workers, and that if we have our healthcare, our schools, and our post office, we have a community. And if you've got any of those, it'll disseminate the community, and we don't want people to have to drive hundreds of miles to get the care that they need.
Right. Perfect. What will be the fallout? What are the impacts on wages and working conditions if the credits don't get renewed?
Well, one of the worst things that could happen is the facility closes down, workers lose their job, families have to leave that community, and the community no longer exists. I mean, that could be very real. That would be the worst part. The other is that the facilities just don't have the money, like I said, to invest in those workers, to keep us there, or to recruit or retain. Who's going to move to a critical access hospital if there's no decent livable wages or support, from the state and the community to keep that rolling? So the most devastating aspect would be for these rural hospitals or clinics to close. That would just be awful for our community.
Yeah, that's pretty tough for a lot of people to fathom, I imagine, since a lot of folks don't live in rural areas. But
right.
That's a real issue. I tell you what. So, we've kind of covered a few of the different scenarios here or situations. Is there anything in particular you'd like to talk about? Anything real major that we've missed?
Well, I think you've covered everything, but I will just say there is a real human cost to this. Like, these aren't just numbers. They are real people. They're our citizens. They're hardworking Montanans who don't have lobbyists in Washington but count on all of us to fight for them. And every missed refill or skip check-in is a person in crisis. Delayed care leads to fear and shame and grief, and we cannot have that. We got to put patients above these profits and fight for our citizens, dignity, opportunity, and respect. If these credits expire, dozens of Montana rural hospitals and clinics, like I said, will have severe strain. We have to extend them or make them permanent, because in Montana and in rural America, these communities look out for each other. Healthcare shouldn't be a luxury. It should be a guarantee. And let's make sure that we don't leave our rural America and our rural Montana behind.
Oh, excellent. Thank you.
Welcome.
Really well said. All right. Well, that's all we have here today. And for the Blue Collar News, we sure appreciate you showing up, Vicky.
Absolutely.
Always want to talk to you, and thank you for some answers, some information to get out there for people to ponder upon. So,
yeah, my pleasure. Thanks for having me, Jason. Good to see you.
Bye.
Bye.